pleasure. Thank you.
So Paul, as we think about healthcare, you've been a local leader in healthcare. Can you give us a little background about yourself and your journey into healthcare leadership as the CEO of Sky Lakes Medical Center?
You bet. When I was growing up, I had a neighbor who was a physician, and I had a mother that had some significant cardiac problems. And in fact, she ended up being one of the very first people in the United States to receive replacement heart valve to deal with her healthcare issues. And so those two factors combined kind of led me to an interest in healthcare. And as I was developing career aspirations, I really initially had plans to become a physician. I did my undergraduate studies in pre-med and public health. But as I did a lot of research for public health, what I think eventually dawned on me is that physicians are truly the linchpin of the healthcare system. They really are, and the captain of the ship. And I appreciated that, but they are of necessity able to address healthcare issues kind of one at a time, right? Mm-hmm. And as I studied public health, I became more interested, I guess, in a broader picture of what I would call community health. Mm-hmm. I'm not even sure that was a phrase back then, it certainly is today. And I started kind of casting about, wondering if there weren't other ways that I could get involved in healthcare in a way that would have a broader impact on the health of a community. Well, this is obviously many years ago, and kind of the nexus for healthcare in a community at that time was the local hospital. And one thing led to another, and I decided to go into hospital administration. And my naive thinking was that that would present an opportunity to have a very broad impact on a community's health, to really influence population health. And I can tell you that for 2/3 of my career, that has been an exercise in frustration. Because we don't have a true healthcare system in this country. We have a sick care system. It's a system that's designed to respond and intervene after somebody becomes ill. And that's true of hospitals too. And so I spent most of my career just kind of trying to create an infrastructure that fixed things when they broke. It wasn't as satisfying as I'd hoped, and fortunately we're moving to a different vision of how to approach healthcare.
What value does Sky Lakes see in partnering with CCC and CHAR under your leadership?
Well, one of the long-time frustrations I've had with what we call a healthcare system is that it's been episodic fee-for-service care. And under that model, from a provider-centric standpoint, the incentives are to do as many things as you can, because you get paid every time you do one of those things. And so, particularly for a hospital, when you've got this huge infrastructure to support that has to be open 24/7, 365 days a year, that's costly. And so really the built-in incentive was to do more operating room procedures, admit more patients, see more people in the emergency room, because we got paid every time one of those patients came in. Well, the problem with that approach is it really doesn't create provider-centric incentives to keep people well and keep them out of the hospital. And I remember when I first became CEO back in 1992, I was interviewed by the local newspaper, and they sort of asked a similar question, not specific to CCC, but what's the value equation here? What do you envision? And they said, well, really, I think my objective is to try to put me out of business. I'm trying to put the hospital out of business. And I'm going to try to do that by keeping people well so they don't need the hospital. Well, fast forward to CCC. CCC has a different payment structure. It's no longer strictly fee for service, it's capitation. And so you're getting paid a fixed amount per enrollee per month to take care of all of their healthcare needs. That starts to align the incentives to say, if we keep that person well, and if they become a lower consumer of healthcare services, it's more efficient for the healthcare system. We spend less on healthcare. And that's the value of partnering with CCC for the hospital. We can start to play with different payment models that start to line up the incentives to do the right thing, to be proactive, to intervene early, catch problems earlier, and hopefully fix them before they become a crisis showing up on our doorstep. And it's been a great partnership.
Got it. So how did the union, when you look at the union between Sky Lakes and CCC and Cascade Health Alliance, how did that union impact the community overall?
Well, it's actually become a pretty dramatic impact. When we first started this partnership many years ago, CCC started out with, for our local population, with only about 5,000 or 7,000 enrollees. So out of 50 to 60,000 people, that's a small segment of the population. It's a valuable segment, but it's not going to impact the majority of people in the community. But it was a good place to kind of cut our teeth on how to start experimenting with different payment models and get providers engaged in a different way. Today, CCC represents about 1 in 4 in our community. It's a much larger impact, and it's a stronger partnership as a result. Because we have the ability to influence the lives of many more people in our community through the partnership.
Okay.
Now, I will be candid in saying that's a good thing and a bad thing, because what it means is more people are eligible for CCC's programs, which are by and large public funded, targeted at low-income people. And that in and of itself, you might say, is not a factor of success, that we have more people eligible for that program. Nevertheless, it's important they have access to health care. And that's what the platform has provided, is early access to the appropriate level of health care. That's good.
Great. So based off on that, Paul, so when you look at how we can uplift the economy locally using healthcare as a platform, what are your thoughts?
Well, so I guess my thinking evolves over time, but if I could spin back, call it 5 to 10 years, I thought it would be ideal if the entire population of this community was in a CCC-like model, a capitated plan. Because that right now we've got kind of 1 foot in capitation as a hospital and as a group of providers. We've got another foot still in fee-for-service with a lot of commercial insurers. So we have this tug of war going on in terms of how we get paid, that says, for this population, I need more widgets, gadgets produced. For this population, I need to keep them out of the hospital. That's not synergy. Now, the reality is, neither one of those payment structures by itself is ideal. They both have flaws. The positive of capitated payment is the incentives to keep people well and keep them out of the hospital. The positives of fee-for-service are that some people, in spite of everything they do, are going to have problems, and they're going to be more expensive to take care of, and the system accommodates that. The disincentive on the capitated side is you might underserve. The incentive is to do less, therefore you might, even inadvertently, not be treating some things that you should be if your incentives aren't lined up. So it's really a blend of the two that I've come around to say, we need both principles at play here in the ideal system, and we're not there yet. We're still in a migrating mode. Same for Medicare. We've got 1 foot in Medicare prepaid plans, Medicare Advantage. We've still got a huge foot in fee-for-service Medicare, and we need to figure out how to move that forward into a different model long term.
Okay. So as we talk about one of the community initiatives around health equity, Blue Zone resonates with us. And you were a pioneer of the Blue Zone initiative. Can you walk us through the rationale, how it became a Blue Zone community and ultimately became actually the first Blue Zone certified community in the Pacific Northwest?
Well, as part of this culmination of my frustrations of the old healthcare system, as an organization, we had a vision to create a healthier community. And we had ongoing, continued conversations of how can we find the resources to invest more proactively in the community. not just equal access to the healthcare system, but actually building a better infrastructure that makes it easier for people to choose to do the right thing that will help them stay healthy and not become sick. The current system, fee-for-service, really hasn't accommodated that. There's really no true incentive for me to invest in keeping people out of the hospital as long as that's my business model, right? So we're in this transition phase to transform, and we said we've got to start figuring out how to proactively invest in the prevention, the education, and the true community health. To make a long story short, I recruited to the community a physician who had trained here locally in our residency program, and she brought with her a master's trained public health nurse. And we began the process of brainstorming, how can we start building an infrastructure that focuses more on health and wellness? And those two were they were firecrackers. They were some of the smartest people I've ever recruited, and I'm proud of that, that we brought them to the community. And they became the fire starters for this conversation of how can we do more? We started a volunteer collaborative of pulling in people from all over the community to have these conversations. We brought in people from the schools, civic leaders, business representatives, people from insurance companies, and of course healthcare providers, and we're having this conversation. Let's look around the community. What can we do to make this a healthier community? Problem is all these people are volunteers, and they get together once a month and then they got to go back to their real job. And so we weren't really getting a whole lot of traction out of that. It was the right people at the table, but we needed more resources. We started looking at, is there a way we can tap into kind of a ready-made infrastructure that we could build upon? And Blue Zones came up. It was relatively new at the time, and they were in a few communities in the Midwest. But we picked up the phone and called the guy that sort of was behind this, Dan Buettner, and explained our situation and said, Dan, is this something you'd look at? And coincidental with that, the governor of the state of Oregon was a former ER physician, and he wanted to push a healthy state initiative, and he landed on Blue Zones. And so the state said, we'll bring some resources to the table. And they went through this competitive process of saying who's going to be the first community that gets to do this. We applied, and we sent a group of people up to Portland and beat the drum, and we got selected. And that began giving us the infrastructure around which we could coalesce all of these different partnerships with some paid, dedicated staff whose sole job was to go out and facilitate conversations and help it change management and implementation. And we've stuck with it for 6 years now. And we went through the process with Dan Buettner and his team of getting certified. And I think we've had a real positive impact on the community. I don't know that this is a long-term journey, so it's hard to step back and say, ooh, we're healthier than we were 6 years ago. I don't know that that's the case, but this is almost generational in nature, and we've got to stick with it for the long term.
As a long-tenured executive in healthcare in the community, I know you've had a lot of accomplishments. What are the top 2 accomplishments where you feel like you're the most that you're proud of?
Oh, great question. And that's hard for me to kind of look inside and take any credit for that, because this is a team sport. And what I've prided myself in is surrounding myself with good people that help make things happen. But what I've tried to do is create an environment where my people can be successful. And I guess the first thing that would come to mind is I'm proud of the culture that I've created in Sky Lakes Medical Center for our frontline employees. They're the ones that do the real work, the heavy lifting day in and day out. And my job is to create a respectful atmosphere where they can be successful doing what they've been hired to do. And to be candid, that hasn't always been the case in our organization, and it's certainly far from perfect right now. But I've prided myself in being available to them, open, transparent, and honest. We've worked hard to hire the right people that truly care and are passionate about other people and about excellence and quality. And I think we've just slowly moved that dial to creating a real positive work environment, and I'm proud of that. I think secondarily is I'd like to think I have played a role in this community of shifting the perspective of how we look at healthcare and trying to instill, I think, a greater level of personal accountability in the local population. That, yes, we all like freedom of choice. Nobody likes to be told what to do. I get that, but there are consequences for choices. And educate people and help make it easier for them to choose to do the right thing, and really truly invest in creating a community that wants to be healthy and that is proud of itself, wants to be more physically active, better access to healthy food, and I'd like to think that I've contributed to moving the community in that direction. Again, we're not there, and it's a long-term journey, but we had to start somewhere.
Got it. So as we think about healthcare, nationally it's 17% of GDP. Klamath is about the same, if not above. What is the future of healthcare's impact in our local community as you look at it?
Yeah, that's been a dilemma ever since I've been in this industry, and we've just kind of watched that GDP tick up, and it's not sustainable, and we are too expensive. Healthcare is just too expensive. Now, you can step back and say, well, let's cut services. Well, that doesn't feel very good. Well, let's cut payments to nurses and physicians. Well, that doesn't feel very good either. Although, quite candidly, that tends to be what we do, is cut payments to providers. That's how we squeeze that balloon. To me, the answer is, it really is focusing on keeping people well. It's teaching them to adopt healthier habits and create an infrastructure where the providers will still be available for trauma, true emergencies, and diseases that happen in spite of what we do. That's always going to be there. But we need to make sure that those are available and create resources to ensure their availability. But what we've got to do is decrease the utilization of healthcare resources, and you do that by helping people be well. Most diabetes is preventable. Most congestive heart failure is preventable. Most of all of the top chronic diseases are by and large preventable by doing 3 or 4 simple things. Eat better, be more active, consume alcohol in moderation. Those things would probably cut 60 to 80% of our healthcare costs if we could get the entire population to engage in them.
Got it. And based off on that though, what do you believe is the current challenge in the healthcare sector as it relates to healthcare, number one, and obviously when you now factor in the pandemic factor, post-pandemic?
Yeah, tough question, not an easy single answer. We as a healthcare industry are clearly migrating more to what we call population health. And we're trying to create models where providers, coupled with partnerships with payers, are increasingly responsible for keeping people healthy. And that's where it needs to go, and that's all the right moves. If we don't do a good job getting the individual consumer engaged in that equation and helping them understand the incentives and or the consequences for the choices that they make, that's a dial that we're never going to move very quickly. I stopped by a local convenience store just the other day to grab a bag of ice for a picnic, and I felt bad because coming out the door was an obese individual carrying 6 boxes of deep fried chicken. And we all love deep fried chicken. I mean, and so it's hard to turn to somebody and say, it's not good for you and you shouldn't eat it, because again, we value that freedom of choice. But the reality is we can't keep eating the way we've been eating. We can't keep eating high fat, high sugared foods and expect to do anything to the healthcare system. We can't be sitting around on our couches playing video games and watching TV instead of being physically active and getting up and walking and moving, and expect we're going to do anything about our poor joints or our obesity. So it's the ability to get the community more engaged in that conversation and make sure that we're partnering in how we make those changes that's eventually going to move the dial.
So, based off on that, which is actually a very interesting insight, so what is your vision of the future of healthcare then?
Well,
An ideal state.
yeah, clearly healthcare is going to increasingly be more than just what we've classically considered healthcare. We're to the point now where we use this phrase social determinants of health. And we're taking more resources out of the traditional healthcare system and investing them in those proactive investments to make sure that we're addressing food insecurity, housing insecurity, that we're creating safe communities, that we're doing what we can to curb tobacco use and drugs of abuse. And the healthcare system is going to have to continue to play a leadership role in investing in those initiatives. Now, we can't do it on our own, and we certainly can't do it on our own and continue to keep the true healthcare infrastructure going. We need government to continue to step up and payers to step up and partner with us in that journey. The real dilemma, though, that we're going to face is twofold. One is the things that are the worst for our bodies are also the cheapest and easiest to access. And so we've got to make it easier for people to access healthy food, and it's got to be affordable, and it's got to be attractive and appealing. And believe it, I get it, I mean, I love Twinkies as much as the next person, but there's got to be some restraint there, and we've got to get people to eat more fruits and vegetables and all that good stuff. And the second issue is education. Like it or not, health status tends to correlate directly with socioeconomic status. In other words, the more educated, if you will, or the more middle class you are, upper class, you tend to be healthier. Now, is it a cause and effect? I don't know. I'm not willing to say that. But the reality is that people that live in poverty tend to be less healthy.
Got it.
And so there's a disconnect there that we've got to figure out how to address.
Okay. So two more questions. Under your leadership, you partner with Oregon Health and Science University to increase access locally through the Collaborative Health Center initiative, which was recently renamed Paul Stewart Collaborative Health Center. How do you see the importance of this partnership for the greater good of the community?
This is an outgrowth of the experience we've had since 1993 of training family medicine residents in our community. What we recognized early in my tenure is that recruiting physicians to practice in rural communities is extremely difficult. And the reality is most physicians are trained in metropolitan areas, and the vast majority of them end up staying in metropolitan areas. We've got 20 to 25% of our people living in rural communities, but we're only getting 10 to 15% of the providers to go practice there. OHSU shared a broader vision of healthcare education at the time, and they were willing to partner with us to establish a 3-year family medicine residency training program here in Klamath Falls. And since its instigation, we've graduated 8 to 10 physicians every year, and 80% of them have gone on to practice in underserved communities, primarily rural communities. Well, a number of years ago, we stepped back and looked at that and thought, look, we're having similar problems in all of these other health professions. Mental health care, pharmacy, dental care. We're having a hard time getting them to rural communities. Can we piggyback on the success of the residency and augment our training of other healthcare professionals to expose them to what it's like to live and work in a rural environment in the hopes that they would then choose to go practice in a rural environment? So the Collaborative Health Center was our foray to expand rural health education. And OHSU has been a fantastic partner with that. Their commitment is eventually to have every single student in every one of their colleges do a rural training aspect, a rotation, if you will, as part of their curriculum. And that hasn't been done before in this state. And I think it will result in more people choosing to want to work in a rural community. I love it here. I moved here thinking I was going to be here for 3 years. That was 35 years ago. It's been a great place to raise a family. We love the outdoor recreation. We love the sunshine. People that live in urban environments, they kind of get used to access to Costco and all of the nice restaurants and theater. I get that. But there are trade-offs with that. And no place is perfect. We need more people to see what it's like to live in a rural community and how great it is, so that they'll choose to come work with us.
Got it. So how do you see your legacy in the community as you sunset into another journey post-retirement?
Well, you know, it's pretty simple, really, and a lot of us espouse this. My only goal has been to leave this community a little bit better than I found it. And I'd like to think I've contributed to that. But I'm still going to be here in this community, and I still care about it. And I care deeply that it continue to be a strong, healthy, vibrant community, a place that's very family friendly and healthcare friendly. And I'm going to continue to be engaged in doing what I can to continue to make our community stronger and kind of try to keep the momentum going.
Great. Thank you, Mr. Stewart, for joining us.
It's been an honor. Thank you.
Thank you.
Appreciate it. Thanks, Pat.
Thank you. Thank you for joining us today on our first podcast. We look forward to seeing you on our next one.